So people are petrified of Trump's presidency, especially with the fact that RFK Jr., Robert Kennedy Jr., is leading the Health and Human Services Division. And that is petrifying to, obviously, the pharmaceutical industry. They cultivated together after Trump's win to figure out what's going to happen with their luxurious expenditure and the fact they capitalize off COVID and other horrific measures. But they're also petrified that it's going to change and warp the food industry, which is why the New York Times, of all places, wrote this article, scathing article about RFK Jr. So it says New York Times wrote a fact check article today defending seed oils and smearing beef tallow, trying to pit RFK Jr. what his rights and wrongs about nutrition are. So here's what it said, and luckily, I didn't have to go through this article. It was already clipped and found the important points because it's a fairly long article. It's the New York Times. I didn't want to have to go through all that. So his claim, this is what they're saying. His claim, Americans are being unknowingly poisoned by seed oils like canola, soybean, and sunflower oils. It could be healthier for restaurants to fry food in beef tallow instead. They're suggesting, so this is what the New York Times is coming up with. What the research suggests, the claim that seed oils are harmful to health is false, nutrition experts say. Decades of research has shown that seed oils are not only safe, but the heart-healthy, unsaturated fats that have been linked to reduced risk for cardiovascular disease, type 2 diabetes, cancer, and earlier death. Seed oils are a far better choice for health than solid fat alternatives like beef tallow, butter, or lard, which are high in saturated fats. Now, I knew a bit about the whole seed oil thing. I knew about the seed oil thing way before RFK Jr. because one of my old neighbors was a old school Italian immigrant. And I mean like old school immigrant. I mean, she was like the Nona of the neighborhood. She handmade all of her pasta and sauces and dinners. Everything was made by scratch. She did the Sunday supper. She goes to mass on Christmas. Like, she was the typical Italian Nona of the neighborhood. And she always raved about cooking in olive oil. That was a staple. That was a staple of her cooking. Everything had to be done in olive oil. Every single thing. Extra virgin olive oil, the better. And I figured that, hearing that, it makes sense because of Italy in the proximity of the Mediterranean areas. There's a lot of olives. So, yeah, it's plentiful. It's plentiful to have olive oil and use that for health, for cooking. But then I got into realizing that later on, even before RFK Jr., I was seeing articles and seeing documentaries and seeing different people stating about olive oil compared to canola oil and how McDonald's, for example, used to cook their fries in beef tallow before they had all these extra ingredients. And the fact that canola oil, for those who don't know the history of canola oil, it's really scathing. Canola oil was first used in automotive industry. Canola oil is a lubricant used in automotive technician. And this was before synthetic oil was made. So before the synthetic oils came out, they used canola oil as lubricants to manufacture cars. But when synthetic oils came out, the people that ran the canola oil industry looked at each other and said, well, now what are we going to do? Because now more people are getting synthetic for the cars. They teamed up with agricultural industry. They teamed up with big food industry, and they teamed up with a PR firm to announce canola oil is safe for human digestion and to use for cooking. And that's where the whole canola oil switch came from. That's where it all came from. Because back in the day, they used beef tallow. They used lard. They used Crisco. You look at your grandparents or your parents back in the 1950s and even before then. That's what they were cooking with. And they've always cooked with that. But it was only just recently they decide, hey, we have this substance that we use for automotive lubricant that's not really used for human consumption. We're now going to market that for human consumption because we have nothing else to do. Otherwise, this goes to waste. Otherwise, canola oil is basically useless. And that's what RFK Jr. is stating here. It's not poison. It's not like you're drinking a gallon of bleach and you got to call the poison control number. He's saying that canola oil slowly damages internally. That's why we got to be concerned about this. But it goes even further. Because in this article also, it says Mr. Kennedy has singled out Fruit Loops as an example of a product with too many artificial ingredients, questioning why the Canadian version, that's me, has fewer than the US version. But he was wrong. The ingredient list is roughly the same. Wait for it. Although Canada has natural colorants made from blueberries and carrots, while the US product contains red dye number 40, yellow number 5, and blue number 1, as well as butylated hydroxytoluene, or BHT, a lab-made chemical that is used for freshness, according to the ingredient label. Used for freshness. What the hell? That's just crazy. Are people eating, urinal cakes? Why would you need it for freshness? It's so crazy. It's so crazy to think that. And to also compare that to using natural ingredients. Well, they're wrong about the number of ingredients, but yeah, it's okay that they're using dyes. Like, how crazy is that? How delusional you would have to be to sit the New York Times and write this article, trying to use this as a smear attack for Bobby Kennedy. Well, you're wrong about the number of ingredients, but we're using the best dyes known possible. As opposed to Canadians that are using blueberries and carrots. Wow. And a lab-made chemical that's used for freshness. Why would that just seems so weird for cereal to be used for freshness? It's breakfast cereal. Okay? It's wheat paste that they mold together into funny little shapes. That's why they also say cereal is not that good for you. So, here goes also to say the New York Times published an article in 2016 warning people about seed oils. They used to warn people against seed oils in 2016. The science did not change since then. Their narrative of convenience did. Never forget that journalists were willing to sacrifice your health just to score ideological points. So look at that. The New York Times actually were against seed oils, and now they're using stupid languaging. They're cultivating this ridiculous article to bash Bobby Kennedy, who is just exactly stating the things you said in 2016. But because it's Bobby Kennedy, that automatically makes it false. Because it's a right-wing thing. It's a right-wing thing to get healthy. It's a right-wing thing for exercise. As opposed to just health. Like, what happened to that? Why does that have to be politicized in a certain direction? Like, exercise should not be a right-wing or a left-wing thing. It should be health. Your health is important. Here's also this. An article. This is from The Guardian, I think. I didn't clip the logo of it, but I think it's The Guardian. And this says revealed. Group shaping U.S. nutrition receives millions from the big food industry. Newly released documents show an influential group that helped shape U.S. food policy and steers consumers towards nutritional products has financial ties to the world's largest processed food companies and has also been controlled by former industry employees who have worked for companies like Monsanto. The documents reveal the Academy of Nutrition and Dietetics has a record of quid pro quos with a range of food giants, owns stock in ultra-processed food companies, and has also received millions in contributions to producers of pop, candy, and processed foods linked to diabetes, heart disease, obesity, and other health problems. And this is also interesting, which I'm actually kind of not surprised. Many of today's unhealthy foods were brought to you by Big Tobacco. Big Tobacco. Now, that doesn't surprise me, sadly, because if you think about back in the day, big tobacco companies, they used to market cigarettes for children. I remember watching advertisements in high school when we were taking media literacy, and we watched, cartoon characters, the Flintstones, the Jetsons, whatever it was, advertising cigarettes for children. And then once they had laws implemented to ban the sale for children, ban the sale for minors, big tobacco companies, a lot of their, expertise and PR stunts that were used to manufacture kids to become smokers, they took that towards processed foods. Same marketing gimmick. They use colorful characters. They use mascots. They know that it's unhealthy for kids. They know how dangerous it is. But look, there's a colorful moose on it. There's Tony the Tiger. There's Toucan Sam. There's all your favorite lovable characters that are getting you to soak up the seed oils and the sugars and all the unhealthy, ill nutrition chemicals that are in your food, that are in your diets, that are making you sicker and causing a burden to healthcare. So here is, this is Casey Means, who is a well-regarded doctor. She's written a lot of New York Times bestsellers. She's been around on the media front promoting about nutrition. And she's about to explain, her and her brother, Cal Means, or is it Cal? Cal Means, went on to Joe Rogan's podcast, and they're about to explain how from top down, the entire health industry has been captured by groups like Big Tobacco, Big Agriculture, Big Sugar, and has just cultivated everything and manipulated the understanding of healthcare. Listen to this.
The tribe, when I was in medical school, it's amazing because of the interest and the fact that, Stanford got a $3 million grant from Pfizer while I was there to revamp the curriculum, and the fact that the American Diabetes Association that makes clinical guidelines is getting millions of dollars from Coke and Cadbury, and the American Diabetes Association is getting millions of dollars from Mead Johnson that makes formula, and Abbott Nutrition that makes formula, and vaccine companies that make flu vaccines. The fact that the money, 8,000 major conflicts of interest were just reported at the NIH with food and pharma. So at every level, the medical guidelines that if you step out of, you are at risk for litigation as a doctor, and the NIH, this thing that we all respect, tons of conflicts of interest, and the medical schools accepting money. The tribe that then you become a part of as a trainee is a tribe that only hears one thing. And so I have a lot of compassion for doctors because I did go through medical school and not learn any of the things that I had to learn after to actually figure out how to help myself and others truly generate foundational cellular health to be healthy. I just look back at what I've had to learn since medical school. I learned about basically organ-specific physiology, pharmacology, and then in residency, I learned how to do surgery. And then, of course, throughout the whole thing, I learned how to bill. But that is ultimately, those are not the tools that actually generate foundational cellular health. 80% of medical schools in the United States don't require a single nutrition course, not 1 minute of nutrition. And yet 90% of our healthcare costs are tied to diseases. The things that are torturing American lives are tied to food. And doctors, it's not a hammer in our toolbox.
As she states, it's not a hammer in the toolbox. They don't talk about nutrition. They don't talk about vitamins. They don't talk about supplements. They don't talk about things like vitamin C and D and sunshine and exercise and things that are most valued. That's why during COVID, they don't ever educate people on this. I had to find out going through this rabbit hole and circulating through many doctors to finally find one that kind of made the most sense. that, hey, locking people up arbitrarily to fight this flu, this epidemic, is preposterous. We should be encouraging people to go out and get sunshine, get vitamin D, get healthier. All these things that we could be doing right now to preventive an attack, rather than just injecting them with the COVID vaccine, which apparently is safe and effective according to CDC, FDA. But it doesn't actually educate people on prevention. But if you look at the industry as a whole, if you look at healthcare as an industry as a whole, their whole objective is not to make people healthier. Their whole objective is not to actually cure diseases. Their whole objective is to prolong your illness. So they're not going to find measures and inform people on preventative care, like good food, good solid nutritional food, proper exercise, proper supplements, proper vitamins you should be taking. They're not going to inform anybody on that. But they are going to get a conglomeracy of outside lobby firms, outside corporations to play into the whole medical up from education to the doctors you have now, to manipulate and just absolutely silence out those measures in place for their agenda, in place for big sugar, in place for harmful chemical injections. There was even something I just read the other day about how they want, there was a mayor of a town, I think it was in Canada here actually, that wanted to keep fluoride in the water. Keep the fluoride in the water. Even though they know that overuse of fluoride is dangerous to health. It's dangerous to health. You brush your teeth with fluoride, and then you're going to drink tap water with even more fluoride, which is causing further damage. That's just crazy. That's just crazy. They know that's crazy, but the mayor being compromised to this big pharmaceutical giants, the same way that big tobacco compromised a lot of children, compromised a lot of advertised celebrities when endorse cigarettes. They're doing the exact same with this. The exact same with this. And that's why it's hard to find people like Casey Means and Cal Means and Pierre Corey and Dr. Robert Malone and Dr. Peter McCullough. That's why it's hard to find their voices, because they've been silenced out of the system. And they bring on people like Bill Gates, who is not a medical professional whatsoever. The man never even finished college. The man's not even a tech wizard. He's never programmed anything. He's an evil serial monopolist who wears a cute little sweater vest, and people think he's a little kooky, not evil, because he looks like a nerd. But he is a psychopathic villain that has taken the entire medical industry, the tech industry, and everything he gets his grimy hands on for granted. And it's abusing so many people. And that's why, even when she says there, doctors don't get taught about nutrition. Even though a lot of it comes from diet. A lot of it comes from just changing up diets, changing up your form, changing up your situation, your lifestyle. And they're just not informing the public on that, because they just want to prolong patients for better business.